Hi guys, I hope you're healthy. I hope you're staying safe. My name is Gertrude, also known as World Class Nurse. I provide content that help new nurses to transition into the workplace. So previously I started a segment called Kenya versus the UK, just to try and gain different perspectives in terms of comparing the care that we provided in Kenya and the care that I am currently providing in the UK. So previously I talked about NG tube feeding. If you've not watched this video, please check it out on Facebook and Instagram and LinkedIn, and I think you'll find it very interesting. So today I just want to talk about manual handling. And manual handling is just the process of moving a load. It could be an inanimate or animate load from one point to the next. So as nurses we come across especially our main load in this case is patients. So we oftentimes find ourselves needing to move patients maybe from one bed to another bed, or sometimes even from the floor if the patient has had a fall, or sometimes when they go for procedures you need to move them maybe and put them to the for example, if it's an x-ray or if it's a CT scan, you need to move them to the bed and then back. So this is why manual handling is a very important part of the job. So let me first start talking about manual handling in Kenya. Before I came to work in the UK, I worked in Kenya for a brief period of time, and I remember this particular incident when I was working in the medical ward, and it was a night shift, and one of my patients or one of our patients, back then we didn't do primary nursing, so one of the patients had a fall. So the other patients, obviously they came to call us, oh, the patient has had a fall, come and see. So we go, we find the patient on the floor. So obviously the first instinct is to try and lift the patient and put them back into bed. Make sure they're nice and warm in bed before doing anything else. So this patient was a really heavy patient, and on that shift it was just me and another lady nurse. So we just tried lifting and we could not. So we needed help. Obviously we needed to find someone to help us lift the patient, and we looked around and the only other option we had was the security guard at the door. So we got him to come, and the three of us lifted the patient back into bed, and the patient, fortunately, she did not sustain any injuries. And we asked her that if she needed help to go to the toilet, she should let us know so that the fall doesn't happen again. So fast forward, I come to the UK, and that's when I realized there's so much more to manual handling. In fact it's a whole course on its own, like how to do manual handling the proper way. So I think this is very important because it's ensuring safety for both you, staff, and the patient as well. If you do manual handling properly, you'll maintain your safety and you'll maintain patient safety, and I'll explain that in a bit. So when I got here, I did the training for manual handling, and that's when I realized there's so much more. When, for example, I'm going to use the scenario where you find your patient on the floor, maybe they've had a fall or whatever, anything else, usually it's a fall. So the first thing is to assess this patient while they're still on the floor. You have to take their observations, and you have to check. Sometimes they have frank injury that you can see, other times it's not. So in manual handling, you don't want to worsen an injury that has happened. So if the patient had a fall and had a fracture, you want to lift them from the floor in a safe way so that not to worsen the fracture. But at the same time, because we are human beings, and as nurses we are doing this job every single day, you don't want to lift the patient up in a way that is going to harm your body, especially your lumbar spine. Usually you find that there's so much strain on your lumbar spine when you're bearing a heavy weight. So if you do this continuously, you end up with chronic backache, prolapsed spinal issues. It's just a whole adverse effect on you. Like, you don't want to have that chronic backache as a side effect of the job. So that's why manual handling is important for maintaining both your safety and that for the patient. So here in the UK, there's first of all, the most basic equipment we use is glide sheets or slide sheets, I'd call them that, and they are made of this material. I don't know if it's nylon. It wouldn't be nylon. It's like nylon and polythene, something on them, on the mixture between the two of them, so it easily glides. So you can easily use it to move the patient up the bed or move the patient from one bed to the next by just layering the glide sheets on top of each other. So this is something I did not see when I was working in Kenya. So another thing, we use hoists to lift the patients from the floor to the bed. So you don't find situations where you lift a patient from the floor with your hands to the bed unless this patient is able to get up and they just need, you know, minimal assistance to get up on themselves and get back to the bed. So you will be using a hoist, and there are different types of hoist. If you're suspecting, you know, a spinal injury, there's a specific type of hoist that will just lie the patient flat and lift them when they are flat. So all these are decisions that you make depending on your assessments of the patient on the floor. So like I said, there's so much to manual handling that I didn't realize there was when I was working in Kenya. So I don't know if it's a case of lack of resources or misappropriation of resources, but I feel like there's a huge gap when it comes to manual handling in Kenya, and that is part of the reason why I'm doing this video, just to, you know, share perspectives and see if improvements can be made, and where possible, you know, let nurses know that there are other options that they can use to ensure their safety while at work. So that is it from me today. I want to wish you all the best. If you liked this video, please share it with a friend. Now I have a YouTube channel. Go to World Class Nurse and subscribe, and follow me on other social media platforms. I'm on LinkedIn, Facebook, and Instagram, and Twitter as well. So just follow me as World Class Nurse. I'm wishing you all the best. Please keep staying safe and get vaccinated.